Hello, I'm Dr. Ben with Salt and Light Direct Primary Care of Petersburg, Illinois, and I wanted to go over the case for DPC. So many people tell me, why would I pay more for having a relationship with a direct care doctor when I have insurance? Well, let's see if you actually do pay more when you already have insurance. So this is utilizing our information from Dave, a healthy 40-year-old male, and the Blue Cross Blue Shield website. We have 11 different Blue Cross plans, and then on the far right, we have a health share and direct care costs put on this chart. So the blue is what Dave is guaranteed to pay based on his monthly premiums. The red is what he pays extra from not meeting his deductibles, and then the yellow is what insurance is actually paying. So in this healthy year, described as 2 preventative visits to your doctor's office, some general labs, and then no ER or urgent care visits, we see actually if we copy that direct primary care costs of $920, and that would replace the out-of-pocket costs of Dave not meeting his deductible. We could instead use the direct care services and see that with the basic plan, Dave would be saving $600 a year. But if Dave would like to pay more in monthly premiums for the exact same healthcare, we see that he actually is saving at least $150 no matter which insurance plan Dave decides to go with. All right, so that was just for a healthy year, but what if Dave gets sick or needs a surgery? Looking at a regular year, what I would describe as seeing your doctor for those preventative visits and then also having 2 acute illnesses, we see that Dave went to the urgent care instead of getting in with his primary care doctor due to the time constraint with the acute illness. Whereas if you have a direct care doctor, you can just utilize your direct care doctor themselves. So Dave would incur $930 from his direct care premiums and then utilizing their acute illness services. And we can put that onto a top of an insurance plan, and still Dave saves over $1,000 by adding the direct care service to his already insurance plans. If we want to have Dave pay more in monthly premiums for the exact same healthcare, we see that he is still saving $240 a year by adding direct care to his insurance plans. All right, and a really bad year for Dave, where he utilizes his primary care doctor 5 times, multiple specialty visits, multiple medications, ER visits, hospital visits where he has to stay for surgeries and CT scans. We see that it's really important to have that insurance or a health share to mitigate our risk for our healthcare costs. Having just the direct primary care alone is catastrophic for Dave. He would pay $81,000 out of pocket, whereas if he has a direct care service and a health share, let's zoom in on that blue and red where it's what Dave is actually paying. We see all of the money that Dave can save. If we use a direct care service with a health share, in this case, to mitigate our healthcare expenses, we see a savings of over $5,000 in the worst year you could possibly imagine for healthcare costs. So it's really time to rethink how we are going to use our healthcare and how we can wisely spend our healthcare dollars. By adding a direct primary care service to your insurance or with a health share, we can save lots of money, receive a better quality of care, and have that great relationship with our doctor. For more information on getting set up, call me at 217-393-8203.